everyone. This is Michael Kellerman, Interim Executive Director for Fairwinds, Nantucket's Counseling Center. Welcome to the second annual ACK Mental. This event, which this year is virtual, is for you, our community. We all have a role to play to break down stigma around mental health challenges, substance misuse, and skateboarding. Yes, skateboarding. Last year, well over 50 people convened at the skate park here on island. This year, we are remote because of COVID and restrictions around gatherings. So you might be wondering, what is ACK Mental? ACK Mental is a community skateboard event, this year a virtual skate park event, to raise awareness about issues like underage drinking, addiction, and the stigmas surrounding both mental health and skateboarding. Skateboarding is for people of all ages, genders, economic status, and ethnic backgrounds. Similarly, mental illness and addiction don't discriminate either, yet stigma still clings to both. Skateboarding connects people through the sheer joy of sharing a sport, a space, and even a mindset. It gives young people a healthy way to release energy, overcome challenges, and do some pretty cool things along the way. Skateboarding fosters inclusion, empowers youth, and bridges social divides. Fairwinds created this event because we are here to listen and to serve the needs of those who call the island home, including people of all ages, young and advanced. We understand that everywhere around us there are barriers to seeking care and getting help. And we want to spread the word about not only what services we offer, but to remind us all, every one of us included, you and me, that asking for help is first and often the most important step to healing. Fairwinds, which has been here on island for 60 years, was founded on the idea that it would provide professional mental health services to one and all, and to never turn anyone away, regardless of insurance status or your ability to pay. And importantly, that we are here for you, whenever and wherever you may be. So, let's get started. Here's how this works. After reaching out to the community, we pieced together footage from skaters who contributed to this event from this last year, which, along with testimonials and footage from ACK Mental 2019, will combine to make this year's event possible in this virtual environment. It's a new idea, and thank you for spending this time with us. So next up, I'd like to introduce Scott Capizzo, our MC and DJ for ACK Mental 2020. Scott is a huge supporter of ACK Mental and is back with us again after supporting the first event last summer. In his own unique way, as you'll see, Scott supports Fairwinds and its mission, which he believes in very strongly.
I'm so glad to be here again this year. Last year was ACK Mental's first event right here at the skate park, and over 50 kids came and enjoyed themselves. This was a fantastic event. Many of the younger siblings did face painting and enjoyed food at the Lobster Trap food truck. There were dozens of people volunteering and enjoying the day. But most important, we were talking about mental health and recovery, trying to normalize the conversation and get people talking about some tough subjects. Well, that's what we're doing again this year, except this year we're doing it a little differently. We're doing it remote. But we're still having fun with cool people of all ages, talking about important things, and just enjoying the skate park for what it is. You'll see videos that people have submitted from the skate park, and not just this skate park, any skate park. Because we're going virtual this year, people can submit videos from anywhere. We have a few people we're going to talk to from Fairwinds, Nantucket's Counseling Center, where everyone can get help, no matter what. And I have a special event for you planned later. Here's a little hint. It's musical, and it's all ACK Mental. And now, let's enjoy some skateboarding.
I'm 11 years old.
I'm Alana and I'm 13 years old.
My name is Chick and I am 9 years old.
I'm Gabriel Fitzpatrick and I'm 14 years old.
I am Vitas. I am 6.5 years old.
Do you come to skate park a lot?
Yeah, recently I've been coming here quite a bit.
I've been coming to the skate park for the past 3 months.
Okay. Only for 2 years.
For about 5 years, 4 years now.
I mostly just BMX bike. This is a brand new BMX bike I just recently got.
I do a mix of things. So sometimes I'll grab my friend's bike. I just got a skateboard, so sometimes I'll skateboard, but I primarily scooter. That's what I started with.
Oh, I've learned a lot. Tricks I've learned, probably a pop, shove it, and an ollie. I'm working on my kickflip right now.
Bunny hop, wheelie.
I'm very new to it, so currently I'm learning how to 180 up the ramp.
You can do lots of cool stuff. And you can also go down hills.
What got me into skateboarding actually was my little cousin. He's been skateboarding for a year, and then he finally inspired me to do it, and he's like, do it, and I finally got a board and I started riding.
The skate park is lots of fun.
I hope it stays for years to come and newer kids to come and learn some stuff, and it's friendly.
I just like coming here with my friends and skating around.
I'm pleased to introduce the Fairwinds Clinical Director, Amanda Wright. She is no stranger to crisis and trauma and has worked with many patients in her career. Now, she heads up the clinical team at Fairwinds. Here she is, Amanda Wright.
Hi, my name is Amanda Wright, and I am the Clinical Director at Fairwinds Nantucket's Counseling Center. Fairwinds wants you to know that we are here to help. You are never alone. On Nantucket, we are here for you no matter what. We have professional clinicians who provide outpatient therapy, in-home therapy, psych testing, med management, peer recovery coaching, and community support providers. We also provide court-ordered programs. At this time, all services are provided through telehealth, and we have staff that speak multiple languages. Our urgent behavioral health care clinic has pivoted to remote, but it works the same way. You can be seen for free weekdays from 5 to 6 by just calling to set up a same-day appointment. Please call 508-228-2689 for an appointment. We have Spanish-speaking clinicians on Mondays, Thursdays, and Fridays. During COVID, we are all grieving the loss of normalcy. The fear and anxiety around health, income instability, and children are extended families. Loneliness and isolation on Nantucket is made worse by the pandemic, and we are here for you. It's so important that we are kind and empathetic towards ourselves and others. Self-care is important as well. Take a walk with a friend, play a game with your children, or reach out to your family to say hi. Please reach out to us. We are here for you. Just call 508-228-2689 and someone will be able to answer your questions. Our goal is to meet you where you are and provide ongoing support and guidance. Take care of yourselves and thank you, and please wear your masks.
The healing can begin. Somebody to talk to, somebody to care. Where the wind is fair, the people are there. Don't despair. always pick up the phone. Fairwinds, they are there, always here to lend an ear. Somebody to talk to, somebody that cares. Somebody to talk to, somebody that cares. Got to find that light inside, you got to keep on shining on. Got to keep on living right, you got to keep on staying strong. Somebody to talk to, somebody that cares. Somebody to talk to, somebody that cares. Free your mind, free your body and spirit, and free your soul. They are here 365 so you can take control. Somebody to talk to, somebody that cares. Somebody to talk to, somebody that cares. I love it. Wow! Cut! Next, we have the program director of the Alliance Substance Abuse Prevention, Sue Mintonen, in conversation with Tom Dixon, who is the legislative liaison to State Rep Dylan Fernandez, based on Nantucket.
So the ASAP mission is to foster a safe and healthy Nantucket community through substance misuse, education, awareness, advocacy, and prevention strategies. In regular terms, that means we like to provide programs for students and adults, whether they are live or now virtual, town meeting or town hall style conversations with speakers, experts, local providers. And one of our more favorite ways to support the community is to help support activities for youth and adults that are confidence building and team building and cooperative adventures. So the skate park, we're excited that Fairwinds is kind of highlighting the skate park with ACK Mental, because that's a place where kids and adults, and it's an all ages place for people to work together to try out some tricks, to learn a new skill, and to mentor each other. And we think that's a fabulous way to stay healthy, both physically and mentally.
I think that's so true. After skating for many, many years, it's really good sport to build your confidence because it's a solo sport and and one of the best part of it is you skate with your friends and you hang out and you have a good time and you kind of push each other to get better. And when you learn some of these tricks and kind of get over this initial learning curve, is so satisfying. It's really good for your self-confidence.
Yeah, and I imagine it fosters a great sense of community because it's, not something everybody does. So you can feel special and part of, a small group, which I think can be really comforting.
It definitely is a community meeting place, and it's all of our park. It's all of ours together. And it was built with our tax dollars, with our CPC money, and it is there for everybody.
Yeah, I think not every community even has a skate park. So I think we've talked before about it being really great that Nantucket has one and that it's supported by the town. The DPW does its best to take care of it, and the people who use it do their best to take care of it.
And there's a lot of energy around the park, and really part of it due to ACK Mental. What's really great is that Rob McNeil, the director of the DPW, has an interest in the skate park and making it better than it was. Fairwinds did an excellent job last year with the event. I unfortunately broke my wrist playing tennis 2 days before it, so I was not able to be there. But it was a smashing success, and I think it really brought out the community. Part of skateboarding is falling a lot and picking yourself up from the ground and moving on, hopefully with not too bad of an injury, but it does happen. But that's part of any sport. But it does teach you that you can slowly get better at something, whether it's learning an instrument or starting a new job or making a big change in your life or making a big move.
Yeah, I like thinking about skating and the falling down and getting back up. It's a metaphor for life. No matter what we do, whether we're talking about our career or a class in school or our mental health, and same with addiction. Sometimes you fall down and you just have to keep getting back up. You make mistakes, you relapse, whatever the case is, and I say it's not always easy, but you can get back up. You can keep going. You don't have to go back to zero. You just stand where you are and then keep moving forward. And I think that's a skill that takes practice. It takes effort, just like skateboarding. It's not easy to fall down. It's not easy to get back up all the time, but when you keep doing it, you eventually master what you're trying to achieve. One of the biggest problems Nantucket faces is a lack of options for treatment. We are grateful that Fairwinds is here for us and does a huge amount of counseling for folks, whether it's a mental health problem or a substance misuse disorder. It's amazing that they can accomplish what they do, but we don't have a sober house. And right now, one of our problems is that our 12-step meetings, those communities don't have a place to meet. It's hard here with the isolation. One issue that ASAP is constantly keeping our finger on is the stigma that exists about mental illness and substance misuse. Having Fairwinds available to our community with their free and their sliding scale fee services is super important for everyone to know about. You can see someone same day, usually, if you're in crisis.
Something that's very personal to me that happened in my life was my dad passed away when I was 12 of alcoholism. And I'm an only child, and so it was just me and my mom. But very important to after that happened was being able to see a counselor and to deal with grief counseling and to realize that addiction was not my fault, an addiction in the family was not my fault. And it was something that I could help process through many years. It was just actually 30 years the other day. And it's not, there's no shame in doing that. So if somebody has addiction issues themselves, or they're dealing with a parent or loved one or somebody in their household with those issues, there's absolutely no shame. There shouldn't be any stigma with seeing somebody to talk about those issues.
We are honored to have Dr. Timothy Lepre here with us today. Dr. Lepre has been a fixture on Nantucket for years. He is here with us today because he also heads up Addiction Solutions, which you'll learn a little bit more about.
I started Addiction Solutions about 8 years ago. Why did I start? Because I saw a number of kids that I'd handed diplomas to at the high school who were coming in with opiate addiction. I saw overdoses, and I saw this as a horrible waste of great people who had a bad problem. We do medically assisted treatment. We have patients, we see our patients or our clients on a weekly, bi-weekly, once a month basis, according to how they're doing. Now, the problem that I saw and that I continue to see is the stigma associated with opiate addiction. I think if we at the hospital took care of broken legs the way we respond to the overdose or patient that comes in addicted to opiates, we'd be out of business. Patients are made to feel bad. Nobody graduates from high school and says, you know what, I'd like to be an opiate addict. Nobody does. And so they get stuck in a rut, and the people don't help them. They're at the bottom of the hole. They've stopped digging, but the people around them continue to throw stuff in on them. It's not a good situation. They feel bad, and then they feel worse. It's a situation that we have to address. We have to address the stigma associated with opiate use. And we don't treat somebody with pneumonia. We don't cast aspersions on them. We don't call them names. Names like junkie, dopehead, stuff like that. It really doesn't help somebody to get over using opiates. What I want to see is a client that comes or a patient that comes to me, and Aileen Womack, who I work with, if they want to stop using opiates, we can help them. That's why I put my phone number in the paper, because I don't want anybody between the person who has an opiate issue and help. Because I'll come in and see him, I'll get him started on medication to get them off the opiates, and then we'll work with them. These clients or people need help. We have help. And we do it, if they got insurance, great. If they don't, great. We have a fund of money that we can help. It gives them an opportunity. It gives them a quiet period amid the chaos that their lives can become. We can help them. We provide shelter from the storm. Giving medication is part of the puzzle. Getting people to understand their problem is another part of the problem. And getting help to deal with the issues that got them using is a third part of the puzzle. When I rely on Fairwinds, we refer over there. We've had patients go over to groups, and I think that that's very important. Giving people medication is only part of it. People have to have the counseling, and that's as important. I see people being successful. I see people getting beyond their addiction. So you give them medication, you get the counseling, and you enable them to get their lives back.
bro. You never know what you're gonna get. You know, twice as big.
The skate park's important because it's a really good community outlet for me to meet up with my friends and hang out with people I haven't met before.
I sometimes usually just come here to sometimes de-stress or just have fun with my friends and hang out sometimes.
I think it's important because it shines a different light on the skate park, and it shows the people that actually care about skateboarding and Nantucket and making it a positive place. As somebody who's struggled with anxiety and depression, skateboarding is something that really helps me.
For me, having a brother who's been sober and someone who suffers from mental health illnesses myself with anxiety and depression, I immediately jumped on board because it's something that's very dear to me and something that skateboarding has helped me a lot.
It's constructive for us people who use it, you know? And it's not only just skaters come here, like other people come here just to watch, and some people come here just to chill. Skateboarding is geometry, you know, it's trajectory, it's math, it's numbers, it's shape, it's a geometrical shape, and filled with thousands upon thousands of equations. You can do so many things with the skateboard, and it's constructive for the mind because you get to figure those equations out. I would say to encourage people, if they're into puzzles and things of that nature, that this will be something for them if they're looking for something that crosses the bridge between that and something physical. Because sports are one thing, but this is something much different. We got this thing called skate, and it's like horse when you play basketball, where one person does a trick, the other person has to do it. And if they don't land it, they get a letter. That game has made me so many friends in life and taught me so many things. Like the trick that I'm trying off of this thing, I learned that in a game of skate from some random person I've never met in life. I just happened to have a skateboard and I was like, hey, let's play a game of skate, you know? And I landed it and I've been doing them ever since. So, yeah, it's very communicative. It's very much so like a brotherhood, if you would, or a club, or something of that nature, where we all kind of help each other. There's no competition. It's just like everybody has to go through the same steps. It's just like walking or running.
Yeah, I think this place is pretty good for mental health. I come here sometimes just to get off all my screens and hang out.
So I'll be having a stressful day at school, like today I actually was. And as soon as I got all my work done, I was like, I need to take time for myself at the skate park, you know, just let it out skateboarding. Today, so far, I've had a good session, so. Skate park's important to me because like, it's just like, I feel like now it's a part of like my life. Like it's something that's really like completely like changed who I am in a sense. And it's just like been a lot to me because that's just like the main thing I do. Schoolwork, skate park right away after school.
Michael again here. Thank you for participating and engaging with us for this virtual event. You know, skateboarding encourages a lifelong mindset of perseverance. Any skateboarder will tell you that you have to fall hundreds, if not thousands of times before you land a trick. We all fall. We all get hurt. We all need to pick ourselves up and try again and again and again, regardless of the bruises we accumulate along the way. Yet the more we try, the less we fail and the better we get at it. In many ways, that's what we are all about at Fairwinds, Nantucket's Counseling Center. This mindset is incredibly valuable to people seeking help with mental health and addiction as well. There will be bad days, there will be setbacks, there will be falls, but we'll keep getting back up and trying. We are here for one another regardless of if and when we land on our wheels. So thank you for being here today and for all of the sponsors and supporters who make this event possible. From all of us at Fairwinds, and on behalf of the community we love and serve, thank you for being with us. Stay healthy and wear your masks.